gave quite a, talking of headline-grabbing, interview at the weekend in the Sunday Times. We've got the headline here: Wes Streeting NHS uses every winter crisis as an excuse for cash. Britain's medical chiefs must accept that money is tight, says the Shadow Health Secretary, and they can learn lessons from Singapore's high-tech hospitals. You have been there.
Yeah, where's the money going to come from to upgrade to high-tech hospitals, Wes? You say, oh, they just ask for more cash. Are you going to give them the cash they need to upgrade to those high-tech hospitals? Or are you just going to sit there going, well, unfortunately, you've spent all of your non-dom tax status money on the NHS workforce expansion plan, so better get used to doing what you're doing. But, oh, they're actually going to do PFIs, though, aren't they, right? One must only assume their cash injection will be from further privatisation through things like new PFI contracts or selling off trusts to people like Centene and Virgin Care.
In fact, looking at the model there and in other countries. We're joined also by Dr. Helen Salisbury, who's a GP in Oxford and joins us from her surgery. Welcome to you, Helen. I'll come to you in just a moment. But do you stand by that, those words, those comments? NHS uses winter crisis as an excuse for cash.
Yeah, what I'm really anxious about at the moment is this assumption that if there's a change of government after the next general election, a Labour government comes in and turns on the taps and there'll just be more money in the system. Now, we have made some...
Yeah, how dare there be more money in the NHS? How dare we have enough money for the NHS to function properly after 14 years of austerity? How about we change the government and there's no extra money for the NHS whatsoever? That sounds like a really big change in ideology. Or is it really, in fact, just a change in management and nothing will fundamentally change, right? Wes, we have had 14 years of failure to invest in the NHS, and you're coming here and saying we're not going to be spending any more money on the NHS, despite the fact the public want you to spend money on the NHS. You're not pandering to voters here. It's incredible.
Some specific, fully costed, fully funded commitments to provide 2 million more appointments a year, to cut waiting lists, to put mental health support in every primary and secondary school, to put mental health hubs in every community, to double the number of diagnostic centres. So there will be some money.
Just briefly, how much in total, in money terms, are you saying you're going to put into the NHS?
Well, in terms of the commitments we've made so far, we've got £1.6 billion, which funds the appointments, the scanners and the 700,000 extra dentistry appointments, and just under £1 billion for the mental health package. So both are fully costed, fully funded.
Fully costed, but it's a drop in the ocean.
Yeah, because that's literally all of the money coming from the non-dom tax status, right? Non-dom tax is like £3 billion projected extra money for the Exchequer, which is going into these investments. So that's all of that additional money, all completely apportioned off to those specific NHS plans, right? And that's it. Nothing else. No more extra money. That's your lot. The rest of it is going to come from growing the economy by pressing the big red growth button.
In terms of the NHS
here's the problem, Joe, and we've got to be really clear about this. The public finances are in an absolute state, thanks to this lot, and recovering from that is going to take time. In addition, even if, for argument's sake, Rachel Reeves had a complete personality transplant and became a big spending chancellor, I turned on the tap. You're pouring more money into a system that is fundamentally not spending money in the right ways in the right places. For example, because
that's the problem with the NHS. It's just not efficient enough. It's too bureaucratic, right? Thing is, ironically, I actually do agree that money is being spent in the wrong places, because the wrong place is the private sector. It's the bosses who are getting paid their bonuses out of NHS money. It's the dividends being paid out to the shareholders of subcontractors in the NHS that are creaming money off the top that could be spent on extra patient care or higher wages for NHS staff. But Mr. fucking Wes Streeting over here, he wants there to be more privatisation. He wants to continue further privatisation. He's been openly admitting it. He has welcomed NHS reform, so much so that Reem Ibrahim from the Institute of Economic Affairs was very happy for him to be talking about reform of the National Health Service, which is, of course, more privatisation, right? There is wasteful spending, but it's not because things are too inefficient. It's because there's too much private sector involvement that this guy wants to expand.
thousands fewer GPs than there were a few years ago. Despite the fact GPs are providing 1 million more appointments now than they were during the pandemic, people can't get a GP appointment, which will cost £40. So they end up in A&E, which costs £400. So it's those sorts of issues that we need to deal with, making sure the NHS is spending the money it already has wisely.
This was the guy who wanted to tear up the GP's contracts, right, during the strikes. It's whilst the government was at war with the BMA and the population was souring on the government because they were standing with the actual medical staff during industrial action because everybody trusts doctors and nurses. Wes Streeting, rather than standing on the picket line with the doctors, instead thought, oh, I'm missing out on the action, let me go to war with the BMA as well, by saying he was going to change the GP's contracts and talk about extra privatisation, right? This guy hasn't got a clue. He's not got a single clue. And he doesn't know anything, because obviously this privatisation doesn't work. I've mentioned this before. There is no extra private sector capacity that they can use. They use the same facilities and the same staff mostly, so there's very little extra capacity that you can get. You just allow people to skip the queue by being able to access the private sector. So Wes Streeting's already pretty wrong about this. But you can tell, right? You can tell that Wes Streeting is not here on merit or of knowledge, right? Because they have a doctor in the Parliamentary Labour Party, Dr. Rosina Allen Khan, right? She was on the front bench in a Minister for Mental Health position, which was then scrapped, so now she's not there, right? But she is somebody who has been openly critical of Wes Streeting's use of the private sector, or his potential use of the private sector, right? Yet, if she can actually be in the position of being health secretary, and she'd know what she was doing. She's qualified to be there. Rosina Allen Khan is a literal doctor who is working in A&E 12 hours a day on top of her MP's duty during the pandemic, right? She has done everything to justify it being in position of health secretary, but health secretary is a position that somebody who's high up in the party is a prestigious position to be in, so it gets gifted to a chum, a Labour together chum of Wes Streeting who doesn't know what he's doing, yet someone who's genuinely qualified to be there, an actual person who's worked in the NHS, gets completely overlooked with this stuff, and in fact has a healthcare position on the front bench that then gets taken away. This is the current Labour Party that we're dealing with, folks.
Let me get into the conversation.
Well, let me get
Dr.
Helen Salisbury in. Listening to Wes Streeting, what do you make of what he says and his assessment of the NHS in terms of wasting money?
Oh, where to start? I think, first of all, he needs to apologise for that headline. It probably wasn't his headline, but I think many doctors found it very offensive, the idea that we're using something as an excuse. There is a crisis in the health service. He had a lovely time in Singapore, but I bet he didn't see any buckets under leaking roofs or ambulances queuing up. Okay, so we do need resources. He's talking about a drop in the ocean. You talked about a drop in the ocean. What we need, we know from the academic analysis from King's Fund, from Health Foundation, that we're about 40 billion a year below the spend of our nearest neighbours in terms of what we're spending on healthcare. So we're doing it on the cheap, and we're not getting what we need.
All right. Well,
finally, it's really weird how you get all of these career politicians on the show and they talk a big game but they don't know any of the actual facts. And then both this time and the previous time when Anna Warrington was on Politics Live, they get an actual doctor to talk about these things. They talk about the actual real problems, which is too much privatisation, too much use of doctors' contracts through the private sector, not enough funding, right? Basic stuff. When you actually get medical professionals on, and Wes Streeting gets made to look like an absolute clown. Like, she's absolutely right. And of course, why would she be nice to Wes Streeting when he's already tried to go to war with the BMA over GP's contracts and the push for further privatisation, which these people all disagree with fundamentally because they know that it won't work in the way that Wes Streeting says that it will.
Well, let me get Wes to respond to that, and then I'll come back to you, Helen.
Yeah, I mean, for the first thing...
You want to apologise?
Yeah, well, the first thing I'd say, Helen, at no point in that interview did I or would I criticise the staff of the NHS, you, your colleagues in primary care, colleagues in hospitals. Like, of the many things that I find depressing and worrying about the NHS, the one thing that I think gives me optimism and hope about the NHS and its future are the people working in it and the people who are doing some really inspiring things.
Yeah, you won't stand on the picket lines with them, will you, though? You won't stand with them on the picket lines. Won't actually support the striking workers when they're asking for a pay rise. And you'll go on Question Time saying, well, there's no magic money tree for us to offer these people proper pay rises, but we'll come to the table, right? You won't actually stand with them, though, will you?
Things every day against this really bleak and challenging backdrop. So I don't think it's the case that you or nurses or doctors elsewhere in the health service are, using the winter crisis to get more money out of government. My anxiety is that the system the system demands more money at a time when it's scarce. And what I'm deeply anxious about is that people start making the assumptions and the plans that if there's a Labour government, there's just inevitably lots more money comes in.
All right,
when the public...
Yeah, how dare people expect the government of the party that's supposed to be the one that encourages the use of the state? Why would people expect them to put more money into a public service that's been starved of resources? How absolutely terrible for people to expect the party of the state to want more state investment. Ridiculous, right? And let's actually have a look at the words that he actually used here. If you look here, right, the NHS is going to have to get used to the fact that money is tight, and it's going to have to get used to switching spend and rethinking where and how care is delivered to deliver better outcomes for patients and better value for taxpayers' money. So literally, please find efficiency savings, which we literally know are not there. We know there's no efficiency savings. They tried forever to find them. The Lansley reforms continually failed. The market reforms have failed. All the money being stripped back and this desire to find those efficiency savings. It's not worked. It's never worked. Right? The only way you save money is by cutting out the actual things that don't produce value, which is the private sector involvement and the profits and the CEO pay. But they don't want to do that. They want to expand that. He literally says, at the moment, we get the worst of all worlds, which is poor outcomes alongside poor value for the taxpayers, right? So he's literally calling the NHS the worst of both worlds at the moment. And he thinks that the solution of that is to go more to the bad one, which is more privatisation.
Finances are a mess, and I want people to think about how we can spend the money that's already going in to better effect.
Well, would you agree with that,
notwithstanding
Helen?
there are
You're right.
challenges.
There are ways we can spend the money better. You're right that we should be maybe redistributing more to GPs, because we know that money spent there prevents money needing to be spent elsewhere, but it takes time. But in fact, general practice has a very small amount. We know that continuity of care really makes a difference. If you can see your own doctor, so I'm really pleased to see that emphasis on having a family doctor. That really helps. There's a few places where we're wasting money. There's this massive contract just gone for data handling to a company that nobody trusts, and nobody knows whether it will work, and it's really poorly specified.
Yeah, but they were sponsoring events at the Labour conference, so Wes Streeting can't talk about why Palantir are bad.
That needs to be looked at. But on the whole, actually, the NHS is surprisingly efficient, is very efficient. There just aren't enough doctors, there aren't enough nurses, and the premises are falling apart.
Right, OK, surprisingly efficient, says Helen. And actually...
Yeah, I mean, as far as per capita spending as a percentage of GDP as well, right? We're pretty middle of the pack when it comes to healthcare spending. There's a bunch of countries that spend more than we do, and we do pretty well with the budget that they're given, right? They just need more budget, more capital investment. We need 40 new hospitals, ironically, right? We just need more hospitals, more GPs, more GP surgeries. We need all of these things there to be more available of, which is going to require more capital investment and more money, which they say they're not going to do because they don't want to turn on the spending taps. And it's great that she literally points out we're spending too much money on private sector contracts. Yet Wes Streeting can't rebuke that because he once said to me more private sector contracts, and the Labour Party is already in the bed with Palantir.
When it comes to funding, the King's Fund published a report in October on NHS funding that said, in comparison to similar countries, France and Germany, the UK has below average health spending per person, has done for quite a long time, and low levels of key clinical staff, which is what Helen is talking about. So it does need more cash, doesn't it?
Well, there is a fundamental fact we will have to deal with if we win the next election, which is the scarcity of resources. And I strongly support what Helen was saying about the need to shift the centre of gravity of the NHS out of the hospital into the community, doing more with and through primary care, through general practice. We're committed to that. And for example, you know, on continuity of care, what we will do is reduce the number of measures that GPs are judged by and funded by, and divert that money into continuity of care. So that's a good example of spending money that's already going in better.
Helen is saying
this is words. Like, this is just words. This is waffle, right? This is essay padding. This is tinkering around the edges of a broken system that needs more funding, right? Because he just won't dare to say, actually, the funding model needs some amount of extra funding added into it, right? Or he won't even say, right, we actually want to change the funding model entirely and, you know, break apart the beverage model, which, you know, In private, MPs admit this. Sajid Javid went on Times Radio to say that amongst Tory and Labour MPs, they believe that the NHS model needs to change. And no matter how many times Wes Streeting says that he wants it done by general taxation free at the point of use, I really don't believe him given the rest of his rhetoric.
He thinks it is rather efficient and quite lean in that sense. You think there's waste and inefficiency. Where is it?
Because, I gave a really practical example of because people can't get a GP appointment, they end up in A&E, which is worse for them as a patient, but also more expensive for the taxpayer. Instead of £40 for a GP appointment, it's £400 for an A&E attendance, which is why, by adopting a neighbourhood health centre approach, by doing more diagnostics in the community, having a wider range of roles in the community.
Let Helen respond.
We've got a situation where there are actually now GPs who can't get employment because the GP practices can't afford to employ them. I mean, it's ridiculous. Got all sorts of other people in primary care, but there are GPs who are now not being able to work because they can't find anyone who can afford. And that's and my other point, Wes, is to come back. You said there isn't any money and our productivity needs to go up. We need to, if you want a productive society, you're really going to have to invest in healthcare. You're going to have to invest in social care and in childcare, because those are the things that are going to get people healthy and back to work. We've got so many sick people. We are the sick person of Europe. And that's partly because we haven't spent on our healthcare.
Bang on, 100%. Lack of funding. They cannot reform their way around the fact that we've not spent enough money on both capital investment and on terms of how we actually pay for our staff, right? We need more GPs, we need more GP surgeries, we need more hospitals. It's as simple as that. We need to expand capacity through investment, not just pretending that private sector capacity exists when it doesn't. She's absolutely right to call that stuff out.
I agree with that point, Helen. I think as well as shifting out of hospital into the community, the other thing we need to do is tackle the social determinants of ill health. So much what determines our healthy life expectancy, so much of what would keep us well and avoid us having to go into the NHS are entirely outside. It's things like, housing, employment, good education, poverty reduction. And my anxiety is we already spend more than 40% of day-to-day government spending on the NHS. When
you look at percentage of spending as with regards to GDP, that's still less than some other countries do within the continent and in the Americas as well, right? Within the OECD. That's not like a gigantic amount of spending in broad terms, right? As much we spend on the healthcare in this country. And it's very frustrating to hear him say, well, we need to get productivity up in the health service, when, productivity in the health service isn't a function of whether people are working harder. It's a function of technology and the rest of productivity within society, right? This is the language of Steve Barclay, who said, well, we can give you a settlement with the unions within this industrial dispute. We're going to have to get productivity increases in response to that. And I'm like, that's not how healthcare works. Healthcare is one of the sectors where pay increases as productivity goes up in the rest of society as well, which is going to require, as this GP has pointed out, more investment in healthcare to get sick people back to work, which they are currently not working because they've been failed because of lack of NHS investment, right? It always comes back to lack of funding.
Resources are tight. Every penny that we spend on that is a penny that we might have spent on child poverty reduction or on housing or on other things that also affect the social determinants. So the point I'm trying to make to the NHS as a system is when resources are scarce, it's even more important that we make sure we're spending the money in the right ways and in the right places. I do think there are big savings to be made on things like procurement. I do think there are big savings to be made by spending money differently within the system. And I think GPs and primary care will be a big beneficiary of that approach, and we've got to work together because one person, one government can't solve all these problems. We need to mobilise the whole system to work together, which is why we'll have a serious 10-year plan to achieve the sort of shifts that you and I both want to see.
Well, that does sound like a long-term plan, and there are many people who want to be treated now because of the record waiting lists that have developed under your government and 13 years of Conservative government. Obviously, the pandemic happened a few years ago, and that has exacerbated the crisis. But why is it, after 13 years of Conservative government, Richard, that we do have below average health spending per person compared to many other countries? I mentioned France and Germany. There's also the Netherlands, Belgium, Sweden. Why?
Well, I think Wes touched on a very important point.
Austerity, that's why. They cut it.
Here. My mum actually works as a ward clerk in an NHS hospital, and there's clearly a lot of efficiencies that can potentially be made in all sorts of things, particularly around patient records and things like that. And I actually hope that...
Actually, literally every single thing is efficiencies, efficiencies, efficiencies. As I mentioned on Twitter, public services are not meant to be efficient, they're meant to be redundant, right? If you operate on maximum efficiency 100% of the time, as soon as you find an externality that you've not got to deal with, then suddenly you'll come up against, you'll get a massive backlog. It's literally what's happened under the Conservative government since 2010. They've tried to operate on maximum efficiency, quote unquote, when those efficiency savings didn't exist, and it's led to a huge waiting list and a backlog of people that need to be seen, right? It's exactly what happened with our supply chains during COVID, right? They were operating at maximum efficiency 100% of the time. And that meant when there was a disruption to supply chains, but where they had to be checking for quarantine when goods were coming in and out, that affected the entire global shipping industry. The whole global shipping industry was affected by this because it meant that you were operating on razor-thin margins that were completely disrupted by just one place having more stringent quarantine checks. You need to have redundancy and some level of contingency built into your entirely into your critical systems.
On a broad level, both parties have basically backed the NHS since its creation, and I hope that actually that we continue to do so.
And the answer to my question on below average spending?
No, but 40%, as Wes said, of government, over 40% is on the NHS. We're spending record sums on the NHS today,
but it's still less per person than many other countries.
And you're right, but as Wes says, there is limited resources of what's but we are spending more per head than ever before.
But the problem is that that's as a result of continued austerity, right? The per capita funding and the percentages of GDP that we put in real terms, continued dropping from 2010 to 2018. It was only under Boris Johnson that we saw that pick up. And of course, we have to deal with a backlog as a response to George Osborne's failed policy, which is going to take time and even more funding to deal with, right? This is the false economy of austerity, where we fail on a public service to the point at which the system starts collapsing, and we have to spend more money fixing it than we would have to have spent overall if we just spent a good amount to begin with.
More and getting less, aren't you? Because we've got, longer waiting lists, longer waiting times, lower patient satisfaction.
I would just say
cancer care has worsened every year since 2010.
I would just say, look, Labour and Keir Starmer have said that the Welsh Labour government is a blueprint for what should happen in the rest of the UK. Per head waiting lists are significantly higher. There's much longer waiting lists over 2 years as well. There's virtually none of that in England, but there is in Labour-run Wales. I actually don't think the NHS should be a real party political knockabout. I think we should all want to see good things happening in the future. I think one thing I hope we can both agree on is the 2.4 billion for the long-term NHS workforce plan. I want to see more doctors and nurses coming through in that, not having to take people from overseas as well.
But I think
there's things we can agree on. But I would like to see us working together.
Yeah, and Helen, I'm going to come to you briefly just before the end of the programme, and you can chip in, but just on this issue of the NHS, I mean, obviously these are not decisions that Wes Streeting is making at the moment, but could be if it becomes Health Secretary. How important and crucial is the issue of cash and money going to be?
It is, and I think, for all the talk, we've talked a lot about immigration. It's an important issue to some, but I think that things like this are possibly more important to people because they can see, and no matter how you
you can't say that. You broke a murder. You broke a murder on the BBC by pretending that immigration wasn't the most important issue ever for everybody in the country. And in fact, that whether or not you can see a GP or whether or not you can put food on your kid's table might actually be more important to a huge swathe of society rather than whether or not we're sending people to fucking Rwanda. You broke like the unwritten agreement, the unspoken agreement of pretending that immigration is a bigger issue than it really is.
About record amounts going in, people don't think it's improving, they think it's getting worse. And the knock-on effects of people on waiting lists who are too sick to work, the government is well aware of this. How you turn it around quickly, though, is the big issue.
Helen, we've only got about 45 seconds, please, on the workforce plan.
On the workforce plan, we were delighted to see it, but it's really, really lacking, because if we're going to train some more doctors, we need to not just get them so they qualify, we need to do more training programs, but there's a lot qualifying and then going elsewhere because there is no further training and they can't get to be consultants. So that's a mess. And they're leaving because they're not paid enough. They're paid vastly less. They're paid less than the physicians' associates. It's a disaster. And so lots of people aren't staying. So there's no point training loads more doctors if they then just leave.
Right. Well, Dr. Helen Salisbury.
Based, 100% based, absolutely smashed it. Tory and Labour getting absolutely annihilated by that GP. Every single time they get a medical professional on, they make our entire political class look like idiots. Because they are, because they don't know how the NHS works. They just go. It's almost like getting these Labour and Tory politicians on talking about the NHS. Is literally getting a mate from the pub coming on to say, "Well, I reckon I can sort this NHS stuff out. I reckon you can just save some money by being more efficient. I reckon that you could just introduce artificial intelligence to bring down waiting lists. I reckon you could do that." Without actually speaking to any medical professionals about what they want, or actually would solve these issues, which is really simple. You just put more money in, pay doctors more, keep them in the UK, have more capacity. You do capital investment. Really not difficult. And I'm really glad that just like Anna Warrington destroyed the Labour argument on this one and the Tory argument on this one when she was on Politics Live, this GB has done as well. And we need to have more actual NHS professionals on more of these shows because they just tell it like it is, right? They do a Mick Lynch. They have no desire to pander to some kind of media narrative. They're there because they know what's up, they know what they're doing, they are professionals who are educated and who are living with the day-to-day consequences of government policy, and so they give critiques straight from the hip. Just like Mick Lynch does. You love to see it. Hey there, if you enjoyed the video, make sure that you like and leave a comment. That helps the video out in the algorithm. If you subscribe and ring the bell, it'll let you know when I go live. I stream every day on YouTube and Twitch. You can also follow all of my socials down in the description. And if you want to support me in a more financial manner, there's a join button for membership to just 99p to be a member on YouTube, as well as a Patreon, and there's some merch there as well. And hopefully I'll catch you on the next video. Take care.